Hi guys, it's Meg again. We're going to go over VAD and Sites for drawing blood, a VAD being a vascular access device. This is something that we will not train you to do. You may go through training depending on where you are to either insert or remove these types of things, but most of the time it's someone who's um, trained even beyond the level of a nurse, I believe. Um, but it's something that you need to know about because it is something that goes in through the vascular access in the body. So the VAD is a vascular access device. It's a tube that's inserted into either a vein or an artery and is used to administer fluids, medications, monitor blood pressure, or draw blood. So you may be drawing blood from one of these devices, not actually from a needle, but from a port. Types of VADs are going to be a CVC, which is a central venous catheter, which is the most common type you're going to see. It's inserted into the subclavian vein and is pushed into the superior vena cava proximal to the right atrium, so that they're able to, this is what they use for dialysis patients who are unable to get any other sort of access. A PICC line, PICC, it's a peripherally inserted central catheter. It's threaded into a central vein after insertion into a peripheral vein, basilic or cephalic, and accessed from the antecubital area. An AV is an arteriovenous shunt. They can have external or internal. It's a permanent surgical fusion of an artery and a vein. That is typically created to provide access for dialysis. As I said, people who need dialysis and are unable to have, don't have veins or arteries that look good enough to actually perform a procedure to have a shunt, they will have a CVC or a central venous catheter. An ART line is arterial line. This is a way of monitoring blood pressure directly from the artery. It's placed in an artery for continuous monitoring of blood pressure or frequent collection of samples for blood gas testing. An implanted port is a chamber under the skin that's connected to an indwelling line, reducing the risk of infection. And then a heparin or saline lock, which is a tube temporarily placed in a peripheral vein to administer medicine or draw blood. This is most likely what you're going to be using. If you're using anything, this is where you're going to be drawing blood from. And then here's just some pictures of the actual VADs, just so you have an idea of what they look like, where the port of entry is, where the actual tubes lie. This is the venous access port. This is going to be the arteriovenous shunt, which is for dialysis patients. This is going to be the central venous device. This is the PICC line. This is the ART line. And this is going to be your heparin lock. So just like we've gone over in probably a couple different presentations, is more venipuncture sites. You're going to have a first choice, a second choice, a third choice, and then you're going to have additional sites that you can choose from. Again, the median cubital vein is going to be your first choice, located in the middle of the arm surface. It's a very large vein, no movement, so it's going to be your optimal choice for drawing blood. The cephalic vein is your second choice. It's this on the same side of the arm as the thumb. It's a little harder to locate, and it does have a little bit of movement, but not a lot. And the basilic vein is your third choice. It's on the same side of the arm as the pinky finger. and it is the least firmly anchored, so it will have more movement than you probably are going to like. Additional sites to draw blood from are going to be the wrist veins and the hand veins. And once again, this is the antecubital fossa veins, the basilic vein, the cephalic vein, and the medium vein. And then additional venipuncture sites are going to be an IV site. When a patient has an IV in an arm, try the other arm. If a patient has an IV in both arms, you might want to try a dermal puncture or a capillary puncture if possible. If it's not possible, then you can try to draw blood below the IV site, never above. Some puncture sites may require additional pressure to stop bleeding, especially if the patient is taking any sort of anticoagulation like blood thinners or aspirin, because it thins the blood. So you just want to make sure that it should take about 5 minutes for each site to stop, usually maximum. So just make sure you apply enough pressure. So this is just venipuncture sites and VADs. Let us know if you have any questions. Send us an email, and you will be taking a quiz over this as well. So good luck.